Okay, for the knee chest table, these are the adjustments as you can make with the movements. You've got this hinge right here, and you'll notice where I'm putting my hand. I'm grabbing it right there. Just grabbing it there and lifting, you can move it from a lower position to a higher position. It gives you about 2 to 3 inches more height, and you get a greater distance this way when you hold it here. I usually try to start about here on most patients. This is the support that's close to the patient's knee. I call it the knee support. This is the support that's close to their head. I call it the head support. These tend to move, they tend to work well if you will move them like an accordion. When one goes in, the other goes in. So they move in together and out together, in together and out together. So if I want to raise this about an inch, that one goes in, this one goes in. If I want this side to go down, or if I want the whole thing to go down evenly, again, we'll move out one notch and out one notch. If I need to increase the kyphosis on the patient a little bit, I can raise one side, like that. And if they're too kyphotic and I need to flatten the back out a little bit, you just raise the headpiece a notch. Now from here, this is the lowest position with the hinge open like that. They're all the way out. If I go down and then bring that in one notch, it's about an inch lower than the last position. Okay? And it's a little closer to the end this way. That's how we adjust the knee chest. All right, so to place the patient on the table, I want to give them some space under the chin, some room. You see there's the bottom of the face slot, and I usually just put my hand there and tell them to put their chin above my fingers. So that gives them some room for their throat, or thyroid, if you will, for our mnemonic. So put your chin above my fingers. Now for starters, I like the thoracics about level with the pelvis. Now right now his knees are back just a little too far. Can bring your knees up an inch or two, that's good. The knees about right, about 10 or 15 degrees past vertical is usually pretty good. The back will relax fairly well. And that's about as close to level as I'm going to get him. If I flip this down to the next position, his shoulders will probably be a little bit low. So we're going to think thyroid for the space under the chin, thoracics level with the pelvis, and thighs. Thyroid, thoracics, and thighs. Oh my.